Hi, I'm Kristen Hart with Natural Awakenings magazine, and I'm here today with Dr. Kristen Barry. Dr. Barry has a master's and doctoral degree in clinical psychology. She's a certified clinical thermography technician and the owner of Space Coast Thermography. Thank you so much for joining us today, Dr. Barry.
Thank you for having me. Pleasure to be here.
So thermography isn't just a business for you. You have some personal experience with some breast cancer, and that kind of led you to looking for a better way for prevention. Can you share a little bit about why thermography is your passion?
Sure. As you mentioned, I have a PhD in clinical psychology, and I worked for about 20 years as a psychologist. Shortly after moving to Florida, I personally was diagnosed with breast cancer. And it was, something unexpected. I didn't have all of the typical red flags that people think of when they think of breast cancer. No family history. And so it was a shock. And that was about 9 years ago. And I started doing a lot of research and working with different support groups in the area, attending conferences, just learning, getting as much knowledge as I could about breast cancer, what causes it, how to prevent it, and how I could help other women. And in doing all of that research, I came across thermography and realized what a great tool it is to help women to be able to see what the risk factor is ahead of time, to give them time to be able to develop a plan and to do things in their lifestyle to hopefully prevent breast cancer. And so that's what my passion and my goal turned to, and why Space Coast Thermography was founded.
That's awesome. That's something great came out of that experience. So is thermography different than other standard imaging, medical imaging systems? And would you recommend thermography as a replacement for other types of imaging?
So thermography is very different than other medical imaging tools. It is not a standalone test. Just like many other tests are not standalone tests, it does provide a lot of information, different information than other tests can provide. So thermography is a physiological test. It's going to look at the subtle underlying chemical and nervous system signals that are developed by our body, and your body is giving off heat. And that's what the camera, the thermography camera, it's a thermal infrared camera, is detecting and picking up. It's looking at these subtle changes within the body, and it's developing a heat map, which can then provide you with a risk assessment for developing certain medical issues. Other tests, such as, that we're familiar with, such as X-rays, MRIs, CT scans, mammography, those are all tests of structure. And so they're looking for specific things like broken bones, tumors, damaged organs, and there's a difference between the structural and the physiological, but they work well together. So we never say that thermography is a standalone test. It has been FDA approved since 1982 as an adjunct screening tool. It's typically used a lot in breast cancer or breast disease detection. It does not diagnose breast cancer, just like a mammogram and an ultrasound do not diagnose breast cancer. And when used together as part of a multimodal approach, when you're working with your doctor and you're doing physical screenings and you're doing thermography and you're doing other imaging like ultrasounds or mammograms or MRIs, you're going to have the best possible option for finding or detecting any kind of issues well in advance of a tumor developing.
So as you just said, thermography is most often thought about in relationship to breast tissue and detecting breast cancer. Are there other health, like maintenance issues, that we could use thermography for?
Absolutely. Our practice does see a lot of women for breast issues. That is the primary use that most people think of medical thermography for. And it does look at more than just breast issues. Even when we do the breast screening, you're also looking at thyroid issues, lymphatic congestion, hormone imbalances. Our medical doctor is looking at the level of fibrocystic activity within the breast, all of the things that can indicate what your risk factor is for developing breast disease. But we can also look at a lot of different things as well, such as source of headaches, if there's any dental pathologies, TMJ, jaw issues, skin pathologies, anything that looks like it could possibly be a dermatological issue that you may want to get checked out that could possibly lead to or be skin cancer, things like arthritis, any soft tissue injuries, carpal tunnel, neuropathy. There's just a whole array of different things that we can look at with thermography, because thermography is providing that risk assessment, that heat map or visual image of your body. And it's looking at all of the subtle physiological changes going on so that it can alert you to issues that either are happening now or could even develop in the future.
That's really cool. So would it also find something like an inflamed thyroid? I don't know if you mentioned that in your list.
Yes, thyroid, definitely. I mean, all of our breast screenings also include images of the thyroid, because there's such a connection between thyroid issues and breast health issues. We always take a look at the thyroid. With our breast screening, the doctor is going to look at not only an increase in blood flow or inflammation in a certain area of the breast that may indicate that a tumor is developing or starting to form, but he's also going to look at the level of fibrocystic activity within the breast, which indicate that there may be hormonal imbalances. He's going to look and see if there's a thermographic response from the thyroid and if there's any lymphatic congestion. All of these things are going to be indicators that your risk is going to increase if there are issues in those areas. So we have a board certified medical doctor who reads all of our images, and he uses a standardized scale. It's called the TH scale. It's a thermobiological scale, and he rates you on that scale depending on all of those things that I just mentioned. So as your rating goes up, it's on a scale of a 1 to 5. And as the rating goes up, it means that your level of suspicion that something is or could be developing in the future is increasing. So when we, have those higher numbers, if you're a TH4 or a TH5, that's when it really becomes important to work with your doctor to get some other tests done in order to correlate the results. You may want to do an MRI or an ultrasound. And we work with, other professionals in the area, other doctors in the area, in order to find the best plan for you.
So it sounds like thermography may be something we want to incorporate in our health plan periodically throughout the year, like you would some of your other screenings.
Absolutely. And the great thing about thermography is that it's non-invasive. It's not painful. Nothing touches you. There's absolutely no radiation. There's no IV, nothing sticks you, nothing pokes you, nothing squeezes you. It's totally non-invasive. And because there's no radiation and it's non-invasive, you can, do this on a yearly basis or as needed. It's a great way to monitor your health, to see if there's anything going on. And then if you're having treatments, you may be seeing a chiropractor, an acupuncturist, a biological dentist, then you can always come back to see if that treatment is helping or improving the condition.
That's fantastic. Thank you so much for sharing all of that information and giving us some ideas on how we might incorporate it into our lives to have preventative health maintenance. If you are interested in talking with Dr. Barry and finding out how you could integrate thermography into your health plan, you can visit spacecoastthermography.com, and you can also give her a call at 321-574-9014. Space Coast Thermography is located in Rockledge, just off Sun Tree Boulevard at 7125 Turner Road. Thanks again for joining us, Dr. Barry.
Thank you for having me.
Everyone, be well, stay connected.